Hello, hello. Welcome to our monthly webinar for February. I am waiting for everyone to join, and we have everyone on board and we can get started. We're also waiting for Dr. Osuna to join. So I'm just going to give a minute or two more for people who have already logged in and joined us. Well, first of all, thank you for joining us. And as far as the raffle we do every time, your HQ needs to be in our system. So if you have submitted a health questionnaire before, you don't need to do it unless it's past maybe it's 3 to 6 months is old. You have to redo it again. As far as the doctor who we're doing the raffle for is Dr. Osuna and the surgeries that she performs. And you need to also complete the Zoom poll that I would release right before we get to answer the questions, and make sure you are present to the end of the webinar. And you get a chance to be in a pool of people who are attending and get a package, $2,000 off of already affordable packages we have. Dr. Osuna, hello and good morning. You're on mute, Dr. Osuna. It's nice to see you. Yeah, you're on mute. You need to unmute yourself. Yeah, we don't hear you.
Hi.
Hello, hi, good morning. I
Good
can
morning.
tell you're in Tijuana and you're in the hospital.
Yes,
Yes. How
I'm
are you
here.
doing?
Very good, thank you.
Awesome.
I finished one surgery and I am here right now.
Thank you so much for attending. I'm still waiting for everyone to join. I'm
Okay.
going to give another minute or two maybe because we want to start with everyone on board.
Okay.
So this is, again, our February monthly webinar for weight loss surgery in Mexico with Mexico Bariatric Center. And today we have Dr. Osuna to guide us through the different procedures we offer. And also at the end, we would answer, of course, I would pretty much cover the travel part of the package. And Dr. Osuna talks about all the medical stuff. Again, thank you everyone for joining us. It's a pleasure to have you on board. Just a little bit about myself. I've been in the medical tourism industry since 2007, and I started Mexico Bariatric Center in 2012. And since then, of course, we have made huge progress in dealing with obesity and curing. As you will see, we have had made a change in over 27,000 people. And you will see all the statistics. We try to cover the commonly questions that you guys can have, but if you didn't hear the answer to the question you might have, please go ahead and put it in the chat and the QA tab, and we will try to get to it at the end. Again, I try to be fast and we cover as much as possible, and we'll try to keep it under 2 hours, and we try to answer as many questions as possible. So today topics are pretty much obesity, its obesity risks. We will show you how to calculate your ideal weight and weight after weight loss surgery, and how weight loss surgery is different from diet and exercise and medications like Ozempic. And then we talk about Mexico Bariatric Center, MBC, talk about our new hospital. We talk about how to get on our calendar and get surgery. And the support programs we have, pretty much Dr. Osuna would take over after that and talk about all of our laparoscopic and endoscopic procedures, and talk about all our reversal procedures. And we touch on financing if you need to have financing. We talk about our nutritional support program a little bit, about our vitamins, which is specifically for post-bariatric patients. And then we try to cover the question and answers. I would release the Zoom poll right there and then. Please watch for it and complete it. It's only a few questions. And then we do the raffle at the end. Like I said, we'll try to keep it under 2 hours. Okay, so we all know what obesity is all about. And, you know, basically our genetics, our lifestyle, the nutritional, you know, day to day, the food that we are exposed to, ultra processed food, sugary drinks, all those that we find around us. In the medical field, they have a formula to kind of a generalized categorizing us into where we stand as far as being normal, overweight, obese, super obese, super obese. That's called body mass index. It's just a formula. You plug in your height and weight and it gives you a number. And there are, of course, you know, there are some scales that they actually, you can stand on and hold on, and they give you your body mass index plus your a percent of your body fat. And of course, you know, our shape is a factor, our frame size is a factor, being a female and male is a factor. So this table kind of gives you some ideas. And let's put an example. Let's say if a female at 5'4" in medium size frame, ideal weight is about 120, right? And if this individual weighs 220, they have 100 pounds extra. So that's what they have to lose to get to their ideal weight. Of course, your goal weight could be a little different from ideal weight, but that's pretty much gives you an idea. And let's say, in general, we say in average sleeve or bypass or duodenal switch, you lose 70%, 65%, 85%. Of course, these are just numbers. And but it gives you a ballpark. Let's say we go with 70%. So you're going to lose in 1 or 2 years about 70 pounds. So your weight after weight loss surgery should be around 150 from 220, which you lose 70. Now, we see our patients actually losing all the extra weight they have. So when they talk about extra weight or percent excess weight, all these are, this is what they're referring to. And there is no limit of how much you can lose. This is a tool that you acquire. That's like how much you work with it to get to where you want to be. Also, you know, the skill of the surgeons, of course, your age, your medication you take, these are all factors of how you end up after bariatric surgery. We have done surveys of our past patients, and as you see, there are different procedures that we got some numbers at 3, 6, 12, 18, and 2 years. Of course, we've done more than 2 years, but this is pretty much what you looking at here. As you see, in the 18 months, pretty much DS and bypass has the most percentage excess weight loss. Sleeve is not bad either. That's about 74%. And I can show you another graph that gives you more ideas of what is it like to have different procedures done. Like red is a sleeve and orange is DS, duodenal switch. And as you see, duodenal switch is resulting more short-term and long-term. If you read the papers in 15 years post-op, DS has the best results over bypass and any other procedures. So this is pretty much what our patients are experiencing. So when they say in the literature, oh, you lose 65 to 75%, as you see, you know, it depends on, again, which center you go to and what is your age and genetics and your medication you use. Of course, you know, we talked about obesity is a result of so many factors. We like in US, we are used to these having large meals and, you know, lack of activities, all that is contributing to this. So when we gain weight, our not only our fat cells get increase in size, they also change structure. And if you look at this, you see on the left side, the adipose tissue or fat tissue of a lean person and then fat tissues of an obese person. You see not only size is different, the chemistry, the components also change. And that's what causing other problems with diabetes type 2, cancer, all those is coming from the changes in our body, right? And of course, we know like all the obesity risks that come with it. About over actually 40, I think it's 41% of adults in US alone are impacted by obesity. And like I said, you know, heart disease, diabetes, lung disease, all this is caused by obesity. And we saw during COVID that how being obese and overweight is a risk factor, ending up in the hospital, ending up in ICU, and even having a more chance of dying. And that was like a warning sign for us to start living healthy. And then we talk about, okay, so what is the cure for obesity and losing weight? Of course, diet and exercise is always number one thing that comes to our mind. You know, eating healthy is great. You always have to do that anyway. And being active and doing exercise is, regardless, that's a great thing to do for our body and prolonging our life and healthy life. Now, the new generation of medications that are pretty good, you know, since the inception. And if you look at history, human being always looked for having that magic pill to take and lose weight. And now we have the injections, the Ozempic type of medications. And they're great, but is not for everyone, is not cheap, and is not long-term. You have to keep taking them. And at this point, bariatric surgery, weight loss surgery is the only proven short-term and long-term solution for obesity. And, you know, I always like this example of how your body reacts when you go on diet and exercise and try to get you back. And the mechanism it works with is our metabolic system. Our brain and our hormones are interacting at a certain set point, which you can call it brain set point or body set point. And let's say if I am at 250 pounds, that's where my body likes to operate around. And when I go on diet, my body reacts by making me more hungry, and it lowers my metabolism. But when you go through bariatric surgery, because of the hormonal changes, it resets your metabolic system. And the minute you wake up, your brain sees you at a lower set point. Therefore, your hunger goes down and your metabolism goes up. And this is the magic of bariatric surgery. We talked about Ozempic type of medications. Basically, if you look at what kind of hormones are changed as a result of bariatric procedure, you see the list of them on my right side of the screen. And as you see, like Ozempic only has the synthetic, which is a fake hormone that emulates GLP-1. And then the newer one like Mounjaro has also other components like GIP, but still, you know, is not these are naturally occurring hormonal changes as a result of bariatric and metabolic procedure, which you don't get. And also, of course, you know, you get the restriction with the surgery that you don't get with Ozempic. So, of course, you know, this is, again, synthetic hormones. You have to keep putting in your body indefinitely. And what is the end, you know, and I saw results of very recent research that 60% of people who start with Ozempic do not continue with it because of the, you know, stomach problems and the cost and inconvenience. So if you imagine this is a pyramid of effectiveness of different tools we have to cure obesity and being overweight, as you see, diet and exercise is great, only works for a certain, very small portion of population. And then you have semaglutide injections like Mounjaro, Ozempic. Again, that works for small, again, 5 to 10% of population. And then we offer endoscopic procedure like gastric balloon and endo sleeve. Again, those are not changing your hormones, so there are smaller portion of population can benefit from that. And then is a gold standard that Dr. Osuna is going to cover, of course, the sleeve bypass DS. So where do we come into the picture? If your insurance doesn't cover this procedure, which is a life-changing procedure, and or they are not giving you and giving you runaround, this is where medical tourism comes into picture, which means going to a different country to get affordable and reliable surgeries. And we are the #1 provider for this. I think Tijuana is probably the center for weight loss surgery internationally. And we're #1 in this space. And even if you look at CDC, you see that they recommend companies like us who give you peace of mind by arranging for your hotel, transportation, all the maneuvers that you need to do down there, so you don't have to worry about a thing. You come with us, we tell you step by step from the time you contact us, from the time you email us, text us, call us, we will be with you. Our coordinators educate you. What does it take to go through this? We tell you exactly step by step what to do. And when you get down there, you don't have to worry. The driver tells you, okay, this is next. You go to the hotel. They tell you this is what next. You show up such and such time in the lobby. So everything is arranged for you and it's equals safety and peace of mind. That's what we bring into picture. And we are a US-based corporation. Actually, I am joining you from our main office in Sacramento, California. And we have years into this business, like I said. And since inception, our idea has been to help patients get highest quality weight loss procedures in Mexico at affordable prices. And it's so when there was a time back in maybe 2010 and 2008 and maybe 12 that a lot of patients hesitated to go to Tijuana, or they were like concerned about safety. And now a center like us is not just becoming a place to go get low price surgeries. We are in high demand. They're looking at us like we are providing superior services over even US and Canada and all over Europe and everywhere else. So our center is becoming a major hub for people who are looking to change their lives. And also you see the spectrum of the procedures we offer, the complexity of things that we do. We are in demand now, not because just the price. We have MBC. Of course, I have more years in medical tourism, same as Dr. Osuna. I know her from 2010. We started working together. So MBC alone has 13 years with 27,000 number successful bariatric procedures with top 5 bariatric surgical teams in Mexico. Now, when I talk about the numbers, since we started advertising the number of surgeries we've done, of course, no center has the same amount of surgeries behind them. So they started throwing out numbers that sometimes are fake. And like sometimes they talk about, oh, we have our patients lost 25,000 pounds or things like that. So they can, but as of January of this year, we've actually done 27,166 patients. That's an exact number. So we're not just throwing some numbers. These are real surgeries. That actually comes to this discussion that when you look into companies, you need to look really deep to see who's behind the company, what are their infrastructure. I was counting the other day, between our US operation and Mexico, if you count all the drivers and surgical teams, we are over 200, maybe close to 300 people working every day around the clock to support our patients. So as you see, we're not a fly-by company. Again, we're gonna look to see why you choose MBC, the number of years, the reviews we have, the surgical teams that we have, like Dr. Osuna. She's an excellent surgeon with so many years of doing bariatric surgery behind her. Of course, these are bullet points of why you choose us. And as you see, there are so many reasons to pick MBC. We will go over, and like our surgeons, we talked about, they're not just assistant surgeons that we just picked yesterday. And that's one of the reasons our complications rates are so low. It's like I always compare assistant surgeons with the experienced team of surgeons, like a pilot who just has maybe 100 or 200 hours of flight time versus a captain that has been doing this for 10, 20 years and has over 10,000 hours of flight time. So which one do you trust to give your life to? Of course, the social media has made it very easy for surgeons to reach out to patients. But then again, it's very easy to make a little cute video on TikTok or Instagram and Facebook and show some before after pictures that may not be real or could have been photoshopped. And people think like, oh, this company is the one I want to go to. So please make sure you do your research and find out who's behind the company. Now, one of the accomplishments that I've done in this industry since beginning, I was always dreaming to have our own surgery center. A surgery center that offers top-notch quality medical services, and the patients have the best experience. And as you see, now let's watch the video. That's what we said. 16th of September, lying in my bed, I'll wait forever. It's never too late. Couple thousand miles, it's just a little space. I'll be. Yeah, so after working on this project for since 2021, I managed to open it in September of last year, and the patients have the best experience, and we see how successful this place has been. We call it Hospital Azar because my mom's name, and it has 4 operating rooms. Again, the medical equipment, everything in this hospital is a state-of-the-art, and we made everything up to the international codes. So hopefully we would apply for JCI soon, maybe in a year or two, and we will get that certification as well. It has about 40 rooms, and with our in-suite X-ray and lab and everything, with our surgical teams, this is becoming one of the top centers in Mexico as well as internationally. You know, again, the nursing staff, everybody works so good in this hospital to make sure the patients are taken care of. As far as, again, getting on our system and getting surgery is very simple. It's like a 1, 2, 3. You fill out the health questionnaire, and for everyone to be today present and be in the raffle, you need to have a health questionnaire in our system. And then once you get your approval, which happens within 72 hours, you know, you have to consider some weekends or like surgeons are busy working, but they do get to it. And you hear from us like, yes, you are approved. And at that point, we all also have to tell you this, we have over, I would want to say 97%, but I would say 95% approval of the patients. And that shows the skill of expertise, the specialty of our surgeons, that they take all the difficult cases. And then once you get the approval, you can actually click to see for that surgeon you got approved for, what dates are available. You can pay the deposit and book yourself. But if you don't, we can touch base with you, or you can reach out to us and we book you. All you have to do is arrange for your flight, or if you're driving, to get there the day before surgery and complete your paperwork with us. That's all you have to do. Again, our packages are all inclusive, and it covers surgeon fees, hospital, hotel stays, of course, the pre-op, post-op tests, medications, hospital fees. We do have nutritional support before, after care. You work through a surgeon liaison, which we're going to get to it in a short time. And we also offer deeply discounted medical tourism insurance, which I highly recommend you guys take advantage of. Our support groups. We have several support groups. The main group has over 13,000 members that are actively posting and interacting with each other. We also have another group which we call, is like a people who are getting on board. And that alone, I was just checking yesterday, has over 4,400 people in that group alone. And then we have some specific groups for specific, you know, people that they can actually interact in a closer way. So this is the kind of support you get before and after. So we have upcoming, so every Wednesday and Saturday, if you don't have a webinar, one of the surgeons are available for question and answers, Q&A. So remember that. Wednesday, 10 to 10:30, or Saturday, if we don't have a webinar, you can jump on our Facebook and ask questions from our surgeons. That's one way. Our coordinators also have live on Thursday, 3 to 4 p.m. These are all Pacific time, right? And we do have nutritional webinars. Christian does those, our nutritionists, which are our staff in office here, and those are bi-weekly. So these are all the supports that we're giving you. Of course, our past patients, Sarita is on Facebook actively, Rina. Jamie, I don't know if Jamie is available to talk to us today, to jump on live.
I'm here, Ron.
Hello, hi. I will give you a few minutes to talk, just a moment once I'm done with, and then Kelly, Tiffany, and Laura. This is just our past patient affiliates that are working with us to support you guys. And I'm gonna let Jamie now take over and talk about her experience with us and what is it like to actually work with us supporting patients. Go ahead.
Hi, guys. I'm here from Washington. I'm really excited that everyone joined. Hi, Dr. Osuna. It's nice to see you again as usual. Ron, thanks for having me. My experience in Mexico was almost better than care I've gotten in the States. I really didn't want to go home because I got such good care there, and the response and the process is just really fast. As far as just getting there and going home, a lot of you always have questions about, returning to work and things like that. Acclimating to that new diet when you get home and navigating that the first week after you get home is really important because you're still on clear liquids and, you can't eat or drink a lot, and to be trying to get home and work through that and trying to get in all this protein and stuff. We're here to help you. Your coordinators are here always. But my experience, I guess, in a nutshell, I would say the staff is so friendly. The drivers, they joke around with you. Everyone just really makes you feel at ease. And to have the support that Ron was talking about with the Facebook groups, there is a group literally for everything for men. You also have the support of the nutritionist, Rena, Sarita, Kelly, Tiffany, Laura, Jamie, everybody. And then we're one of the only people, or one of the only facilities also come with the surgeon liaison, Jen. Ron will probably go into that, but she's also really helpful. She's a direct contact for us in between the surgeons. So if for some reason, we can't get a hold of surgeon, they're in surgeries, things are busy, you have Jen, the liaison, to reach out to too, and you'll have her information once we get you booked. And coming home from Mexico is easy too. I wheeled my own suitcase home. It's basically some lifting restrictions. Once you get home, you feel a little bloated and a little tender, but nothing extremely painful. I was really shocked how simple my life was to get back to and get in the realm. I'm actually coming up here for 3 years post-op. I still have restriction and I've lost 220 pounds. You can see a lot of my profile stuff through the website. So feel free to contact me. I see some patients in there saying, hi, I'm glad you guys joined today. Thank you for being here. And I hope everybody has a wonderful weekend. And always reach out to me if you need anything. Thanks again, Ron, for having me. And I'm just happy to be here. And I love this place. And I will support 110% and put my back into everything. And my word is my word with this company. You will make the right decision. Bye, guys.
Thank you so much. We appreciate you. Yeah, so one of the things that Rena and Sarita do is podcasts. I recommend you jump on those. Again, for people who joined us later on, if you don't have a health questionnaire, please go ahead and do that and look for the Zoom poll and attend to the end of the webinar so you can have a chance to win a $2,000 off of your surgery package. We talked about the network of exclusive best bariatric surgeons in Mexico, and this is the team. You know, of course, Dr. Osuna, that she has over, I would say, 14, 15 years doing bariatric surgery. Dr. Miguel Montalvo, Alejandro Gutierrez, which is our chief surgeon, Dr. Rodriguez Lopez, he's our super surgeon, and Dr. Jesus Ceja. These are all very respected surgeons. Most of them are double board certified, not only a certified surgeon, but also board certified surgeon for bariatrics. And this is the way we handle your health questionnaires. And that's when Jamie mentioned about Jen, which is our surgeon liaison. She's actually a doctor that has education in Mexico as well as US. She's sitting in every health questionnaire that goes between the surgeon and the patient. First of all, we have developed complex algorithms that matches you based on your qualification, your situation with the best surgeon for you. But still, again, Jen is covering all the back and forth between the surgeon and the patient, making sure every file is complete and done right, and will communicate with you to stop and start if you're taking medications and all that. Primarily, we're using Hyatt Hotel in Tijuana, which is #1 hotel in Tijuana for your stay. If you are alone, you can choose to stay in the hospital on the day of your arrival, so you don't have to stay in hotel and pack and unpack and go back and forth. We also opened, as you see, the companion now has option to stay with you in the hospital. We also expanded the hours of visitation from 7 a.m. to 7 p.m. Our pre-op diet is basically depending on the BMI you are in. If your BMI is close to 30, all you have to do is a 2-day clear liquid. When you arrive, we still have popsicle and jello and broth ready for you. And but if your BMI is higher, now you have to do more work on your pre-op diet. It's very important to do a good job, you know, because that makes your surgery easier on you and the surgeon. So I would recommend that you go on low carb, high protein diet and do it for a week, 2-3 weeks, as much as you can. So again, the medications, if you are taking medications on a regular basis, you'll be advised what to stop or start, and that's what we do. And but in general, don't take any Advil or any NSAIDs 1 week before surgery. If you're injecting Ozempic, please stop at least 2 to 3 weeks prior to the surgery. And if you're taking any medication on a regular basis, please bring the bottles with you to Tijuana or Guadalajara for that matter. Actually, I need to mention that in a bit. So, so on the day that you arrive, we want you to arrive before noon, and your departure should be anytime after 1 or 2 p.m. And we use medical passes, so the wait is minimal going through the border to US side. Of course, remember, this is a border and we have no control. That's why we tell you take the 2 p.m. Flight. As far as, again, I mentioned that you have option now to go straight to the hospital. On the day of your arrival, we do all the pre-op tests, everything we want to make sure is correct and be prepared for the next day. On the day of surgery, if you're in the hospital, no problem. You just get ready to go to the surgery. And if you don't, we pick you up from hotel. Now, Hyatt is only like 2 blocks away. If you're actually in the hospital on the west side, right, you could see the Hyatt from our hospital. So that's how close we are. But still, you know, of course, we transport you there and we get you ready for surgery. You stay there, depending on your procedure. Of course, the endo procedure is only 1 night, sleeve 2, bypass and DS 3 nights, so we don't shorten you on the stay. And we do all the tests, pre-op, post-op, like I said, you're ready to go home. For people who travel long distance, you know, you can still stay extra in Tijuana or stay in Hampton Inn, which we have a special for our patients. You can mention our company name and they give you a special rate. This is pretty much, again, we would tell you every step of the way about pre-op diet, about post-op diet. You know, post-op diet, for example, is just a 4-week or a month of going from liquid to solid. It's very important to keep up with this for your long-term success. One of the reasons we are so successful because we manage our surgeons' load on a daily basis. We give them optimal amount of surgery. So, and that's one of the reasons. Of course, our surgery center is specialized in this type of patients, and the surgical teams are specialized. It's not they do some other surgery and then do 1 surgery a week. This is what they do every day. And our complication rates is consistently has been less than 1%. Sometimes 0.05, sometimes 0.07, but this is one of the best statistics around. Now, Dr. Jacqueline Osuna, I have a pleasure to know her for like 14, 15 years. She actually lives in Guadalajara and she comes to us every other week of the month, pretty much. And she's one of the best. She's very caring individual with the skill surgery. Of course, she's a general surgeon as well. And she has all the certification. She attends all the IFSO. She does all type of surgeries like sleeve, bypass, DS, revisional surgeries. So, and I'm gonna let her take over and talk about all the options we have in our center and talk about some of the most popular ones. And then we go back to me to talk about financing. Thank you so much, Dr. Osuna, it's yours.
Hi, everybody. It's a pleasure to be here with you, and it's a pleasure to work with MBC because it's a very organized company and very secure, like Ron explained you before. I am a general surgeon 18 years ago after I made a bariatric surgery fellowship, and I have a fellowship too in the Cook County Hospital in Chicago and in the University Hospital in Chicago too. And it's a pleasure to have patients like you. Okay, What are my options in bariatric surgery? We divide in laparoscopic surgeries and endoscopic therapy. It's different, like Ron explained you before. The endoscopic therapy has a specific indications, and that's why in other patients doesn't reach the goal like laparoscopic surgeries, but have a specific indications. In the laparoscopic surgery, we can find the gastric banding, the gastric sleeve surgery, mini gastric sleeve, single incision gastric sleeve, RNY gastric bypass surgery, mini gastric bypass surgery, duodenal switch, single anastomosis duodenal switch, that is the SADIS, and various laparoscopic gastric revision surgery, gastric bypass reversal surgery when it's indicated. And in the endoscopic therapy, we have the gastric balloon, endoscopic sleeve gastrectomy, and the endoscopic bypass revision when it is not possible to revive, but surgery is indicated too, and robotics too. Okay, the gastric sleeve surgery, it's a surgery when we remove the 80 to 80% of the stomach using 1 to 5 tiny incisions. That is called a minimal invasive laparoscopic surgery. We use always a boogie to calibrate the sleeve of the size of 34 French. Which used to shape the new stomach to avoid any structure in the stomach. These procedures utilize restrictions to limit food intake, change the gut hormones and cause hunger and satiety, and slow gastric emptying. Okay, all the procedures have specific indications, and the expectation in the gastric sleeve is to decrease the levels of ghrelin, that is a hormone of the hunger, increase the levels of GLP-1, increase the levels of PYY, and no changes in GIP. Okay, that means that the digestion before the gastric sleeve and after the gastric sleeve, it is the same because we don't alterate the bowels. The pros is good to be that it's easily to reduce it if the patients stop losing weight or if the patients want to lose more weight. A high amount of the excess weight loss is comparable to the gastric bypass. Resolutions of comorbidities like high blood pressure and diabetes, and no change in the anatomy and less absorption, like I explained you before. Short recovery time. And the cons that have the gastric sleeve is that if the patient has previous gastric acid reflux, it's not the best procedure for the patient because could increase or worse the acid reflux. It's not reversible, and the medium time of the losing weight after 1 year is the 72%. It's a procedure, a quickly procedure. It takes from 45 minutes to 1 hour and a half. The medium time is 1 hour, but it depends on each patient. Okay, the single incision gastric sleeve surgery, the SILS, the operation is performed from one opening roughly 1.5 inches. Wide in the umbilical or navel area. This is the same procedure that the gastric sleeve, but the approach is one incision. The expectations are the same of the gastric sleeve and the and the pros are the same of the gastric sleeve. The only different cons in the single incision is that not all patients are eligible for that, because when the BMI is higher than 40, it's more complex because of the size of the liver. And the time, it's a little more time in the operating room than gastric sleeve, because it's for one incision, and the average in 1 year excess weight loss is the same in the gastric sleeve. Okay, the endoscopic gastric sleeve surgery is a smaller stomach is formed by folding the stomach to create a banana-shaped tube. These procedures utilize restrictions to limit how much the patient can eat at the time. They call gastric sleeve surgery endoscopic, but it's not exactly the same, because in this procedure we don't take off any part of the stomach. It's create a small tube, but the part of the fundus of the stomach is not taken. That means that we don't take off the ghrelin that we take off in the gastric sleeve surgery with laparoscopic. And the expectation is hold less food and decrease food intake, a lower amount of excess weight loss, and not well suited for patients with gastrointestinal bleeding, large hiatal hernia, or previous abdominal surgery. And the pros is reversible, reduce complications because it's endoscopic, no incisions are removing tissues, and shorter recovery time because it's a ambulatory procedure. The cons, potential risk of partial openings in the stomach pouch because of the sutures, potential risks of ulcers. That's why it's patients with a background of the ulcers are not eligible for this procedure. The duration time is less than in a laparoscopic gastric sleeve, it's around 30 minutes, and the recovery is quicker. Okay, the gastric bypass surgery, RNY. Gastric bypass surgery forms a new stomach that is a pouch, while the remaining stomach stays in place. The small intestine are rerouted to bypass food digestion, which creates malabsorption and reduce calorie intakes. It's a combined procedure because have the restriction of the small pouch, but the malabsorption because it's a bypass. The expectation is that only a slight decrease in the ghrelin because we don't take off the remaining stomach, and increase the levels of GLP-1, increase the levels of the PYY, and JIP is decreased initially in diabetic patients. The pros is a gold standard is the reference procedure in the bariatric surgery, and has a high amount of excess weight loss, improves the obesity-related comorbidities like diabetes, high blood pressure, sleep apnea, and others too. And the cons are that change of vomiting or dumping syndrome, but is not so frequently in patients and has a higher risk of ulcers. It's the excess weight loss, it's a little bit higher than gastric sleeve, it's 75%. It takes a little more time in the operating room because it's a bigger procedure. It takes 2 hours, it's the median time, and the recovery is almost the same. Okay. What is the best surgery for me? Sorry. we have the gastric sleeve and the gastric bypass. When the patients have obesity grade 1 and have a lot of previous scar tissue because another surgery or previous ulcer can, it could be the gastric sleeve the best option for the patient. Sorry, I can see the complete. In the gastric sleeve, we don't alter the anatomy, and I can see the complete bed.
It's just the excess weight loss that is a little higher. That's all. Sorry for.
Yes, I don't see the complete, but it's a little less the weight loss, but it's not a bigger difference. But in the gastric bypass, we prefer in patients that have acid reflux or GERD because the gastric sleeve could increase a little more the acid reflux. The patient has slower metabolism, it means maybe in patients older could be better the gastric bypass. And patients that had the background of sweet tooth, it's better the gastric bypass. Here, the anatomy is alterated, but in these patients, it's higher the weight loss than in the gastric sleeve, but it's not so big the difference. It depends most of the complete evaluation of the patient to decide the gastric sleeve instead of the gastric bypass or the opposite. Okay, the mini gastric bypass divides the upper portion of the stomach to we make a pouch like a small tube, which holds only 2 to 6 ounces of food. The intestine is looped to connect with the new stomach to decrease the amount of calories you absorb. It's similar to the RNY, but it's only one anastomosis. And reduce the expectation is to reduce the feeling of hunger through the alterated gut, early satiety or feeling full after small portions, reduce calories and nutrients absorbed, and resolves diabetes. Resolve diabetes type 2 and other chronic diseases. In the pros is a single anastomosis instead of 2 that in the RNY. Safe, effective, and shorter procedure than the standard RNY bypass. And one of the most effective surgeries to reverse failed gastric sleeve and lap band. The cons in the mini gastric bypass is chance of vomiting and dumping syndrome, but it's not a high risk too. A high risk of ulcers. If the patient has that background, we prefer the other procedure, and chance of bile reflux. The bile reflux we can reduce making with the original technique that is a long pouch and lungs bowels. The percentage of the excess weight loss is to 76% around that percentage. And the time of the surgery, 1 hour and a half, 2 hours, and the recovery is similar to the gastric bypass and the gastric sleeve. Okay, here, what is the best surgery for me? Gastric bypass or mini gastric bypass? If the patient has a marginal ulceration and wants more weight loss and have the metabolic diseases, is related with the gastric bypass. The weight loss is documented a little less than in the mini gastric bypass, but it's too similar. If the patient has acid reflux or GERD, we have less nutritional deficiency, and the shorter procedure is a mini gastric bypass. But if the patient has the background of the alkaline reflux, it's not an indication in the mini gastric bypass. It's preferred in the gastric bypass. The results are similar. The only is that we have to evaluate the patient to decide who's is more beneficent of each procedure. Okay, the duodenal switch surgery, or SADIS. Duodenal switch surgery, also known like biliopancreatic diversion with DS, is a powerful weight loss and metabolic surgery. Okay, the expectation in this kind of surgery, it's the patient lose from 50 to 80% of their excess weight in the first year. We have a high percentage in duodenal switch patients with type 2 and that are cured after a surgery. A cure is in time ago we refer cure, but in this moment we said that the patient has a remission of the disease, even though the patient doesn't take any pills for the diabetes. The disease is a remission. It's not specific like a cure. Malnutrition is a problem with DS, and vitamin is a must after surgery. We don't have election. We don't have it's not an option to supplements after the DS. You have to supplement every day, and you have to take care about after this procedure. The pros are up to 80 excess weight loss in the first year. Stomach size is reduced. The highest metabolic effect, highest expected weight loss. In this patient, it's malabsorptive and is restricted because it's a combination of the gastric sleeve with a connection of the duodenum with the ileum, that is the terminal part of the bowels. And the cons in this procedure is stimuli restrict with vitamins required for life, like I can explain you before, higher risk than other bariatric procedure. Not all surgeons are familiarized with the SADIS or with the duodenal switch, because we try one part of the body that is the duodenum, that is a specific part that we have to dissect with all the take care of, because we have to separate from the pancreas. That's why you have to check that your surgeon has experience in GS. The average of the loss, the excess weight loss is the higher, is to 80%. The duration time of the surgery is 3 hours, and the recovery is too similar to the other procedures. Okay. In which patient is better the DS, and in which patient is better the SADIS? The SADIS is the same like DS, but it's one and only one anastomosis. Okay. In patients with a BMI higher than 50, it's the same for both procedures. In DS, the body absorbs fewer nutrients or calories. The dumping syndrome is one of, if once it's purely, helps relieve sleep apnea, and the average excess weight loss in 2 years, it's 45%. In the single loop duodenal switch, that is the SADIS, the BMI is the same, is one anastomosis or mesenteric window, a newer procedure with less data. The first procedure that was in the bariatric surgery was DS, and the SADIS is a modification of the DS with only one anastomosis and has less years than DS. And the average excess weight loss in 2 years is 35%. Both of these procedures are indicated in patients with ones or needs a revision of a gastric sleeve, because and the patients with doesn't have any acid reflux. Why? Because we are going to preserve one valve, that is the pylorus. And if the patient has acid reflux, in some patients could increase the acid reflux. If the patient needs a revision after a gastric sleeve and doesn't have any acid reflux, it's both are a very good procedures to do it, a revision. Okay, el PCOS, it's a problem that has a lot of patients with overweight, and especially in women, obviously, because there are alterated hormones because of the obesity. The fat tissue in the body alterate all the hormones, and some patients can get pregnant about that situation. Bariatric surgery is shown to improve the reverse metabolic syndrome in women with PCOS, reduce symptoms, and help restore normal ovulation. And numerous weight loss surgery patients of Mexico Bariatric Center with PCOS have been cured and overcome infertility. Okay, how fast can I return to work after bariatric surgery? We have here an explanation, but depends the work that you perform, because almost all patients in all procedures, one after week, if we don't have to leave, if we don't have make an effort in the job, after 1 week, most of the patients come back to their jobs. If you can see, it's almost the same for each procedure, because all procedures are performed laparoscopic, and laparoscopic has the advantage of that the recovery is so quickly. The most important thing is to check that the patient in their jobs have to leave, and after that increase the return of their job. But other kind of jobs are similar.
Okay, well, thank you so much for covering all the procedures, or at least the ones that are most popular. One thing I forgot to mention, like there is no limit of what we can do in our center, including BMI. We do patients of BMI of over 100. And so that's a kind of expertise we have with our surgical teams. As far as financing, you can look in, the first place I would recommend you look is your bank or credit unions that you have a relationship with. Other than that, there are some sites that we have linked in our website, and also the companies like SoFi, Lending Club. But make sure you don't apply for so many places, maybe 2 or maximum of 3 at each time, because it's going to hurt your credit score and you won't be able to get any loans. Yeah, at this point, we don't have any in-house financing, but that's what your options are. As another option is, if you're thinking to have your surgery done in the future, you can book with us. We'll call it lay over. So basically, you pay the deposit and then you start paying more deposits toward your surgery until your surgery is due, which we require for surgery to be paid 2 weeks prior to the surgery. That means that even if you're taking, a lot of patients take a cashier's check with them, but you still need to send a clear picture of the cashier's check to our administration 2 weeks prior to the surgery, so we know how you are paying. Even if it's cash, just send a picture of the cash. And the one thing I mentioned earlier was MTI, the medical tourism insurance. This is we are offering this at $179. This is at least half price of what you would have had to pay. It covers you from the time you depart the day before surgery to 45 days after. That means when you come back to US, you still have the coverage for complication, for all these items you see. And I highly recommend for you to take advantage of this situation, because it's very affordable. At the same time, it's best to have it and not use it, but you need it. And you need it, you don't have it. Again, we talked about our nutritional program and all the Nutrition Plus. We do have a subscription that you go on, which we call Nutrition Plus, that gives you a lot more than just the regular support. And I always emphasize on patients taking bariatric vitamins, not any multivitamins, bariatric vitamins. And Christian can help you with this, to tell you what kind of multivitamin you need or some other supplements you need. But as you see in the table, the ASMBS has a requirement for post-bariatric patients to take certain nutrition and supplements. And that's why it's so important to look into those. For bypass and DS is mandatory. And for sleep, we would recommend at least the first 2 weeks, because you lose weight, but how successful you are down the line in 7, 10, 8 years, your bone density, your nerve system, all that, you have to do a good job, not only on the nutrition part, also on the supplement. Okay, so and our Emerge, you can order it online, emergebariatrics.com, or ask our nutritionist. It comes in soft chew, chewable, drinkable, and capsule. Again, our website is a huge resource for you to get educated about different type of procedures. And we have numerous blog posts to educate about different aspects of surgery. I'm going to, like I mentioned, release the Zoom poll at this point. It's like 5 questions. Please make sure you complete those as we are opening the Q&A session. Let's start answering these questions between me and Dr. Osuna. So Angie is asking that she was told to take 2 days pre-op diet, which is the clear liquid. And she's asking, beside medications and alcohol, what else do I need to know about pre-op diet? Did I?
I can hear you. What was
Okay.
it?
So Angie is asking, she was told that she only needs to take 2-day pre-op diet, which is the clear liquid. She's asking what other restrictions beside medications, which I mentioned, and alcohol do I need to follow?
Mm, The restrictions are in the liquid diet. You only take the liquids that you could see through the liquid. Sometimes we thought that in the liquid diet, in the clear diet, it's included the shakes. But if she is in clear liquids, it has to be all the liquids that you could see through the liquid. We can take some medications that are necessary, but we have to revise the medication for that 2 days.
Also, one more thing I forgot to mention was the smoking. If you're a smoker, please stop at least a month before and after. This is huge for your surgery itself and your recovery. Rachel is asking that she has been gaining weight for 2.5 years after sleeve procedure. Do you recommend a revisional surgery?
It is we have to review your health questionnaire because we have to review how much did you regain, and in this moment how is your BMI. But normally if you regain, the patient needs a revision. It doesn't mean that the sleeve was performed inadequate. Sometimes require malabsorptive procedure, but in the revision we can see if the sleeve increase its size or it's only that the patients need a malabsorptive procedure. But you could need maybe a revision of the sleeve.
I hope I say the name right. Aklia is asking, does MBC issue medication post sleeve surgery to prevent gallstones?
To prevent what?
Gallstones.
Okay. We don't give that medication, but we can advise some medications. But if you lose weight like a healthy procedure, it's less frequently that you develop because it depends of the intakes, and it depends of your genetic too. But we can advise some medications to prevent, but it's not all patients need that medication.
That one I can answer. Tracy is asking, is it true if the complication happens after coming back to US, my insurance won't cover anything related to out of country? Now, this is you talking about the insurance you have in US, but that's not true. And also, like I talked about, MTI would cover complication, but your insurance should not deny you because you had surgery somewhere else. They're asking, I'm scheduled for surgery at the end of the month. I booked sleep with Dr. Seha. How does doctor decide whether I choose correctly? Actually, this is a question that Dr. Osuna also mentioned. Every HQ is evaluated based on the information you put. And that's why it's important to do the health questionnaire as exact as possible, input accurate information and complete, so the surgeon can evaluate you case by case and tell you what's the best for you. Now, one more thing is you have to remember, when you go to Tijuana, you still have, well, that's actually a good point. Dr. Osuna not only works in 1 week in Tijuana, 1 week in Guadalajara. So whether you go to Tijuana or Guadalajara, you still talk to her before the surgery. So she will consult with you again. Make sure you're comfortable. Make sure is a proper procedure for you. And it has happened that we have changed the procedures. It happens like once in a while that when you go down there, we can switch you from sleeve to bypass. It's not like if you go down there, they're gonna take you to the OR and do the surgery. We would still talk to you, make sure everything is okay, all right? So you don't have to worry. Okay, this one again, Candice is asking, could there be any fees outside the packages that I showed you? So the prices I showed you is the starting prices. There are extra fees. Let's say if your BMI is more than 49, 59, 69, all those trigger extra BMI fees. Also revisional fees. I have actually a question here that David's asking. Maybe we can cover both of them at the same time. David's saying that what is the cost of procedure for bypass reset? He had RMY in 2016 and he lost 170 pounds. Now he gained 100 of it back. So, of course, you know, bypass revision is a little harder procedure, and Dr. Osuna can talk about that a little bit more. As far as the price, again, you're going to have, I'm not sure about maybe $700-800 extra because you're getting a bypass revision. So I'm going to let Dr. Osuna talk about maybe bypass revision options.
The gastric bypass revision, it's a challenge procedure because we have to review the pouch and we have to review the length of the limbs. Sometimes if you stop losing weight or if you regain, it's related with a shorter limbs. You don't have the enough malabsorption. That's why in the revision, we have to review that your gastric pouch is in a good size. If you have increased it, we reduce it, but we have to review to the length of the limbs. If the length of the limbs are so shorter, we distalize the gastric, your previous gastric bypass to give you more malabsorption. And that is the revision of the gastric bypass.
It's interesting because we have started another webinar that is for revisional surgeries. And I wish I had those charts to show. There is another question down there asking, what's the chance of getting a revision if you get sleeve surgery? In a literature, in the published data, it shows 15% need revision. But what we're finding out from our patients are only 5% of our patients need a revision with the sleeve. So remember that the surgeon's the skill. The place that you go have your surgery is also a factor. You know, we talked about age, talked about genetics, talked about the medication you take, but also remember where you go to get your first surgery. So, and then if you look even like we don't, like Dr. Osuna mentioned about revisional for bypass, we have a higher, much higher success with our bypass revisional surgery than published data. So when we say like, oh, it's hard, that means you have to remember we do a lot better job than any other center or any other options you may have. So Paula is asking, why is it higher, more longer weeks to do the pre-op diet if you have higher BMI? Why is it longer pre-op diet for higher BMI?
The higher what?
Higher BMI. If you have a higher, you know, we showed like, okay, if your BMI is like over 40 or 50, you have to be doing the pre-op diet for 2 weeks, 3 weeks, 4 weeks. Why is that?
Why? Is because when you give you the pre-op diet, our goal is not to lose weight. Our goal is to reduce the hepatic size, because we make the surgery in the stomach, but the liver is upper to the stomach, and all the surgery we have the liver up. The pre-op diet is to reduce the size of the liver, and if the patient has bigger BMI, the fat in the liver is bigger. It's more. It's a heavy liver, and you have more fat liver when you have a bigger BMI. That's why the pre-op diet, it's more time in the patients with a higher BMI.
Great. So Teresa is asking, my companion is choosing to stay in the hospital with me. Will they go to the hospital with me in the morning of my surgery? Yes. The answer is yes. So the first night you arrive, you stay in Hyatt or the hotel, and then they transport you and your companion to the hotel. What would be the factors for choosing between gastric sleeve and single incision gastric sleeve? So when would you recommend somebody to get a single incision sleeve instead of just a regular sleeve?
When the patient doesn't have previous surgeries, and when the patient doesn't have a BMI higher than 40, it's recommended because it's aesthetic, the incision, but the procedure but itself is the same. Inside of your abdominal cavity, the procedure is the same. Is the same gastric sleeve. The only difference is the recovery, because you have only one incision, and the aesthetic situation, because it's through your belly button and it's only one incision.
I already answered Aklia's question about what's the revision rate for persons who get VSG. Usually they say about 15%, but patients that we have had, they only a little over 5% needed a revision. But remember, also the surgery, there's how you follow up, you know, the support you get after surgery. That's why those support groups like the Facebook group, everything you can get support after is huge. How long does the gastric sleeve surgery take? I think Dr. Osuna mentioned about from end to end is about 1.5 hours, but the surgery itself, maybe 45 minutes. Okay, so Lori is asking, I already scheduled for a sleeve surgery, but what if bypass is better for me because I have reflux?
If you have, like I explained you before, if you have previous acid reflux, the best procedure is the gastric bypass. In some patients with level acid reflux, when we make the sleeve and we repair the hiatal hernia, it could be enough, but not in all patients. That's why if you have previously the background, we have to review your health questionnaire, but I think that if you have the background, the best procedure for you could be the gastric bypass.
Yes, they're asking about if they live in Canada and how did they get their hands on Emerge Bariatrics? So what happened after, especially after COVID, it became very expensive to ship to Canada. So that's like, you can still get it, but it's very expensive for the shipping handling. Unfortunately, we have not worked with, we haven't been able to get the vitamin in our hospital yet. We are working on that. So soon you'll be able to pick at least some. When you go down there, pick some with you and take it home. Okay. Tracy is asking, I have not been able to control my eating before the surgery. Will a sleeve help me control that?
To control what?
She says she's been overeating. She cannot stop eating before surgery. Is a sleep going to help her control her eating habits?
Okay, if you go with the nutritional instructions and you follow, it's easier. If you go to the groups that helps and talk about their experience, it helps too. If you begin with the gastric sleeve, it's gonna be controlled by itself, the intake, because you are going to feel full so quicker than you feel it before. But you have to relearn the size of your stomach. The sleeve could help. If you, I don't understand if you have the sleeve or you are going to have your sleeve. You have previous sleep or not?
No, she's just preparing to get the sleep.
Okay. But this, like I explained you before, the sleep at itself is gonna help you to control. But you have to go slowly with the liquids because you are going to learn the new size of your stomach. But your stomach is going to tell you when you have to stop. That's why you have to pay more attention when you begin with liquids, because the sleep, it's gonna tell you when you have to stop and could give you, could help you to control that intakes, but to go to the support groups, it's gonna help too because of their experience.
Just when you're looking to post up vitamin, because I'm getting some questions for those, make sure it's made up to the ASMBS requirement and the ingredient is high quality. These are two things you can look into. And then if you're in Canada, for example, look to see what's available to you without paying arm and a leg to get the shipping, handling, or taxes, custom on me. Okay, so let's go back here. Wow, okay. Stephen is asking that his BMI is about 32, but he's been given recommendation to get bypass because he has acid reflux. And he takes 20 milligram of omeprazole daily.
Okay.
Yeah.
Yes, in your case, your BMI is not too high, but we have to evaluate, because if you need the omeprazole every day, the sleep could increase more your acid reflux. That's why in your case, we could perform a gastric bypass, but we are going to give you the malabsorption to lose the weight, but not too much. The length of the lips could be less because you don't have a lot of weight to lose. We made that modifications in the surgery for specific cases. In your case, the length of the bowels, it has to be less because you don't have to lose too much weight. But the bypass is gonna help, but itself to the reflux. It is gonna resolve.
Kylie is asking if my BMI is over 50. Will I be required to lose a certain amount of weight or just work with nutritionists to follow the 8-week pre-op diet? So like Dr. Osuna mentioned, the pre-op diet is really not to lose weight. It's about making room for the surgery and your liver shrinking. So remember that. So do as good of a job as you can with the amount of weeks we tell you. So as far as having a slide for, so you will get the recording of this webinar available to you. Usually they send you the link. If you didn't get it, please contact us and we will send you the link so you can review again the whole webinar if you missed part of it or something like that, or if you want to see of course, you know, the pre-op post-op diet would be given to you once you sign up. It will be emailed to you. So there, Sharon is asking, if my BMI is at 60, will I still have a favorable chance of losing a good amount of weight on sleep?
Yes, it is possible to lose the 75% of your excess weight. In some patients, is a little less. In some patients, reach more than that. That's why it's a very good procedure to lose weight, and you could reach the goal.
So again, like you saw, for example, Jamie, she has lost 220 pounds. These past patients that we work with, there's no limit of what you can lose, you know? It's a tool you acquire, work with it. And again, the number we throw out, like 70, 80%, doesn't mean that you cannot lose 100%. So just work with your tool. Now, this patient is asking JP that I had the gastric sleeve 2 years ago, and I started at 252. My current weight is 185, and I'm starting my menopause. How do I decide if I should do another surgery? And I'm a 5'4" medium build. So that's good because 5'4", we just did the example, right? Medium build needs ideal weight. Of course, that's ideal, 120 pounds. So she's at 185 pounds. She still needs another 60 pounds to lose. So do you recommend her to get another surgery or just keep working with her sleep?
If the patient, after the surgery, the patient is regaining, first we have to check about your change in the change in the intakes that the patients make in the last year. But if the intakes are the same, and if the patient don't make a lot of change of that, and even though the patient is regaining, the ideal is a revision, because first we try to check if it's a change in the intakes, but if it's not and the patient is regaining, the most probable is that the patient needs a revision. Maybe check, maybe some patients we can predict, we can figure out the best procedure of each patient, but we can predict which patient is gonna need malabsorption in the bariatric procedure. Sometimes patients reach the goal with a restricted procedure, but other patients make the same things and doesn't reach the goal. And in that patients, we need a malabsorptive procedure.
Thank you. Samantha is asking, will I have to stop taking Lyrica to have the surgery?
No, it is not needed, or only stop one day before of surgery, and bring it with you to reinitiate when you begin with liquids.
Can you talk about hair loss after bariatric surgery?
When the after bariatric surgery, that's why the supplementation is indicated in all procedures. Like Ron and I explained you before, in the malabsorptive procedure, we don't have any choice to do it for a period of time. We have to do it all the time. But in all procedures, we recommend the supplementation, because the patients, even though have overweight, the vitamin reserves are not very good. That's why in the first year is the main weight loss. That's why we advise to supplementation to avoid problems in your hair, in your skin, in all the to prevent the deficiencies of vitamins. We recommend the supplementation. If you follow the nutrition instructions, it's less probable to happen that.
Another good question that actually brings up a good subject is Danable is asking, do we require a primary care visit before the surgery? So we like you, no, because we do your evaluation based on your health questionnaire you provide to us. However, we want you to do just a blood count, blood test before you come. Because especially for revisional procedures, because if you have lower hemoglobin, we need to take care of it before you get there, so you don't need blood transfusion. So please make sure, especially if you are a revisional surgery, do a blood test and make sure your blood is correct. And you can actually send it to us and we can check it for you. After the procedure, we recommend that you go back to your general physician 3 months after to check everything again. And after that, you just have to keep your regular checkups with them. we highly recommend for you to have a passport book or passport card, because that keeps any uncertainty coming from back from Mexico to US. They're asking what happens if there is a flight delays, weather issues, etc. Well, we understand and we work the best we can to accommodate you. The best way is because the driver contacts you the day before your departure coming to us. So make sure you stay in contact with them and your coordinator if you have access to them. Make sure you're being handled if you have delays in your flight. If you need dental services, ask Oscar, and we would recommend a dental service. At this point, we don't provide that. There is no additional charge if you are coming by yourself and you want to stay in hospital or hotel. There is no difference between the package. We cannot have anybody in the OR. It's just not up to code. I mentioned 2 or 3 days you stay in the hospital after surgery. Okay, so I think I have about 22 more open questions that I think we are getting to a point that we said we want to keep it under 2 hours. So I'm gonna stop here and we would get ready to do the raffle. And then anybody who didn't get their questions answered, please call us or email us or circle back, and we would be more than happy to answer that. Again, there are opportunities to ask medical questions from our surgeons Wednesday, 10 a.m. Pacific time, Saturdays, 10 a.m. Pacific time again. If it's a webinar, you have the webinar. You can ask questions or the surgeon live would have the question answered. Okay, so I have all the people who are qualified based on the criteria I mentioned. And I'm going to pull one name and see who is going to be. I'm going to read it to Elena Watkins. Elena Watkins. So I'm going to look for you and let you talk to us, Helena. There you go. Are you there?
Hello.
Hi.
Hello.
Hi.
Hi, my name is Helena Watkins, and I am a truck driver. My husband is actually having surgery at the end of the month. I'm kind of nervous, but it's something that I need to have done. I think I want to watch his process just a little bit before I'm completely on board, but it is something that I need to be done, that needs to be done.
So you're coming along with your husband?
Yes.
Okay, well, that's great. So you get to see what it's like to be there. It's actually a great experience, honestly, to go to Mexico and get this thing done. It's a different experience, yes.
Jamie's been wonderful answering all of our
Oh,
questions.
Jamie is your coordinator.
Yes. So yes, thank you. I appreciate it.
Oh, you're welcome. So again, congratulations. Thank you everyone to join us today. And Dr. Osuna, thank you for taking time and be with us. I would actually myself be in the hospital next week and hope to see you. If not, we see you down there. Everyone takes care and be well, okay? Well, thank you again,
Thank you.
and we see you next time. Goodbye.
Thank you.
Bye-bye.
Bye.